Okay. We will open the chambers of the heart starting from the right atrium here. So the order of dissection will follow blood flow going into the heart and back out of the heart. So we're looking at the heart from its right side, and this is the right auricle of the right atrium here. Was already sliced open. Superior vena cava, inferior vena cava. We have the ascending aorta right there. The right pulmonary veins draining into the left atrium. Then this one, this is the right ventricle, right marginal or acute artery, which comes from the right main coronary artery. So let's go back to the right atrium and its auricle here. So to review what we have identified from previous videos, so this groove here is that's the sulcus terminalis. So anterior to the sulcus, the atrial wall looks rough. Posterior to the sulcus, the atrial wall looks smooth. So when you open up, you can see the reason why you have rough looking areas. There are bundles of cardiac muscle fibers in the rough looking areas. Those bundles are called the musculi pectinati. We have the musculi pectinati or pectinate muscles, no, in the wall of the auricles, no? But in a large or in the main chamber of the right atrium, the wall looks smooth. So the superior vena cava was also cut open right there. Same down here. So on the inner side, no, so the groove is known as sulcus terminalis on the outside. Internally, there is a ridge, same area where the sulcus terminalis is present, and that is called the Crista Terminalis. No? So musculi pectinati, the muscle ridges, no? MP, Manny Pacquiao. Then we have here the Crista Terminalis. So what is the significance, no? Anatomic significance of the Crista Terminalis? At the uppermost part of the Crista Terminalis here, at the area where the superior vena cava enters the right atrium, in that area is where the Cyanoatrial Node is located. So what is the Cyanoatrial Node? It acts as the main pacemaker of the heart. So it generates the cardiac potential or the impulse that will make the heart beat. So as the main pacemaker, it dictates the number of times the heart should beat. What are the other features that we're supposed to identify here? So this part is actually the septum between the right atrium and the left atrium. So this oval shape structure here, that is called the fossa ovalis, no? An ovoid surface, no? In the fetal heart, no, that is actually an opening which is called the foramen ovale. So fossa ovalis, no, when it is closed in the mature heart, and in the fetal heart, that is called the foramen ovale. And then another important feature that we need to identify down here You can see I can actually stick my forceps, no, in this opening right here. That's the opening of the coronary sinus. Coronary sinus again is the large vein running mainly on the posterior aspect of the heart in between the left atrium and the left ventricle. And right there, that's actually, those are the tricuspid valve leaflets. The right atrioventricular valve, or the tricuspid valve. We're looking at the superior side of the tricuspid valve. It has 3 valve leaflets, so we can actually draw a triangular shape area here, no? So the corners of the triangle should fall at the fossa ovalis, coronary sinus opening, and the tricuspid valve. So what do we call this triangle? That is called the Cox Triangle. Cox Triangle, just like your Cox bacilli, Koch''S, not the soda drink, no, Cox Orange Sprite that is sold in bus terminals. So Cox Triangle. So what is the significance of the Cox Triangle? At the center of the Cox Triangle is the location of the Atrioventricular Node, the other pacemaker of the heart, no? But that pacemaker will just follow the cardiac pace that is set by the Cyanoatrial Node. So this node here creates the action potential. Atrial walls contract. The impulse is transmitted to the AV node. Then that AV node will transfer the impulse to the ventricular wall via the AV bundle and the bundle branches. So the atria contracts alternately with the ventricles.